All right. Hi, Mama. Today's the day we're going to talk about safety. I know this is on the top of everyone's mind. It's very important. There's a lot to say on it. There's a lot of reasons to feel very, very good about the use of CBD. So I'm going to run through this review first from 2011. There are updates. They simply say the same things. I'm going to briefly talk about the little updates that there are, but I think that this 2011 study, which runs through 132 studies leading up to that point, is really the best thing to go through for detailed information. And that is why, as well, we find those other two studies, and almost every study that ever mentions safety mentions a study, safety and side effects of cannabidiol, a cannabis sativa constituent. All right, so I'm going to start running through it. The abstract, which is always a good place to start just to give an overview, says that cannabidiol has multiple actions, including anxiolytic, which means anti-anxiety, antipsychotic, antiemetic, means anti-nausea, anti-vomiting, and anti-inflammatory, which, as many of you know, covers an entire range of things that we're all struggling with right now. Being inflamed is a modern day problem. Several studies suggest that CBD is non-toxic in non-transformed cells. That means that it is toxic in cancer cells, but it's not toxic in our normal cells, and does not induce changes on food intake, does not induce catalepsy, does not affect physiological parameters, heart rate, blood pressure, and body temperature, does not affect gastrointestinal transits, and does not alter psychomotor or psychological functions. Also, chronic use and high doses up to 1,500 milligrams a day of CBD are reportedly well tolerated in humans. This is the abstract. That means this is what these authors got from 132 studies. All right, let's go on down. Let's get into some of the nitty-gritty here. So there has been concern or discussion because it can kill tumor cells, cancer cells. People have worried about whether it would also kill normal cells. I already discussed that, but it exerts anti-proliferative and pro-apoptotic, I never say it, I just read it, effects in tumor cell lines. This is a good thing. That's great that it does that. But they did test just to make sure, and they found out the CBD does not, and this is a quote, does not affect the vitality of non-tumor cell lines, contrary to what does occur with human breast carcinoma cells, human prostate carcinoma cells, human colorectal carcinoma cells, human gastric adenocarcinoma cells, rat glioma cells, rat thyroid cells, transformed with the VK-ROS oncogene, and rat basophilic leukemia cells. So all those cells are subject to apoptosis, which means death when subjected to CBD in studies. Not making any health claims, just telling you what the study says. However, normal cells are not subject to any of that. Now, I think it's important too. Analysis of CBD's effect on embryo development. Again, no health claims for you moms. Go listen to Dr. Jess's podcast on why she recommends CBD in pregnancy, birth, and breastfeeding, and babies and children. I'm not going to take that on myself to recommend it, but it does say analysis of CBD's effect on embryo development is important because it raises the question whether expectant mothers can take CBD, and consequently whether it affects fetal development. In vitro, which means in the lab, results show that CBD did not significantly alter embryonic development at concentrations of 6.4, 32, and 160 nm, which is a lot. Studies have evaluated the antipsychotic-like properties of CBD. In several studies, it's actually been shown to be as effective as the most effective schizophrenia drug. But unlike that drug and others, this cannabinoid has not been shown to induce catalepsy, even at doses as high as 480 milligrams per kilogram. That is like taking, say a 200-pound man is about 92 kilograms. So we're talking 92 times 480. That's so high. and it didn't induce catalepsy. CBD shows an anxiolytic, again, the anti-anxiety-like and antidepressant-like effects, but does not induce motor changes, which we do know the antidepressants do. So that's part of what this study is looking to do, is as it goes through the different things people might use CBD for, it's checking to see if it also might cause similar side effects to the medications that we believe work for it, or the science currently is arguing work for it. Specifically the physiological parameters in animals at a wide range of doses, 3 to 30 milligrams per kilogram. And 30 milligrams, so 30 times 90, if we're talking about a 200-pound man, is that 2,700? Yeah, that's almost 3,000 milligrams a day. And it is saying that it did not affect blood pressure, heart rate, body temperature, glucose levels, pH, PCO2, PO2, hematocrit, K plus or Na plus levels, gastrointestinal transit, or rectal temperature in rodents. The results were the same even after 14 days of treatment. So these are all animal studies here. We'll get to the human studies in a minute. After they used CBD 3 times a week at a very high dose of 60 milligrams per kilogram. For 12 weeks, they did not experience significant side effects such as ataxia, kyphosis, generalized tremor, swaying gait, or tail stiffness. This has all been looked for both in animal studies and a little less so, but also in human studies, and not found. It also did not produce mesis in mice, vomiting. It also did not exhibit appreciable effects on mean blood pressure in rats, arterial blood gas tensions, pH, anything to do with respiration, ventilatory responses, or respiratory minute volume. This study provided evidence that CBD does not affect ventilation. And again, this was high doses, 2,000 micrograms intra-arterially. Next, our gastrointestinal system had no effect on the rate of intestinal transit or the rate of gastric emptying or cardiovascular, antinociception, hypothermia, or respiratory parameters. An evaluation of the neuroprotective activity of CBD revealed that CBD was not only free from significant side effects, but also associated with cardiac, hemodynamic, and ventilatory benefits in piglets. This is how we learn this stuff. We start with the animals and then we move on to ourselves. Effects in memory. CBD at doses of 0.75 to 2.0 milligram per kilogram, which is a moderate dose, were tested to see if there would be cognitive deficits or anything of that matter, which they did find at that dose of THC, and no, there was no significant effect on performance observed. Now we're at humans. In human studies, CBD administration did not induce side effects across a wide range of dosages, including acute and chronic dose regimens, and tolerance to CBD did not develop. You don't develop a tolerance. You just find your daily dose and you take it, and you may even be able to reduce as your system balances. So let's start with some of these studies. In the 1970s, human studies showed that oral CBD intake from 15 to 160 milligrams, which is a pretty standard dose, daily dose for my customers, and then says inhalation or intravenous, were not followed by ill effects, just across the board. And there were several studies they're referencing there. CBD does not interfere with several psychomotor and psychological functions in humans. CBD does not affect heart rate, blood pressure, or performance in the verbal paired associate learning test as measured by recall score at doses up to 600 milligrams. That is a very high dose. And for it to not affect your ability to perform on the verbal paired associate learning test, that's a sign that your IQ is not affected. Your ability to think quickly and fluidly is also not affected. It is not something that impairs judgment or your ability to think properly. Subsequent studies concerning the antipsychotic effects of CBD have not reported any side effects after CBD intake. And I will say that those antipsychotic studies found benefit. So it was helping with no side effects. Chronic oral administration of 10 milligrams of CBD daily for 21 days did not induce any changes in neurological, EEG, clinical, EKG, psychiatric, blood, or urine examinations. Likewise, oral CBD administration in healthy participants and in epileptic patients. So this is at either 3 milligrams per kilogram, which is a fairly normal dose for my customers, all the way up to 200 or 300 milligrams daily, which is very, very high, but what epileptic children do tend to take, for 135 days, was well tolerated. No signs of toxicity or serious side effects were detected on neurological and physical examinations, blood and urine analysis, or EKG and EEG, which were performed at weekly intervals. So that is stunning. That is a very high dose. That's taking a bottle of my strongest, 2 bottles of my strongest a day, and having for 135 days and having no signs of toxicity or serious side effects, well tolerated while they're being studied and watched. So let's see. It was also evaluated with Huntington's disease. By the way, it's very effective for epilepsy. Effects after oral CBD were evaluated under a double-blind, randomized crossover design, an excellent study, high gold standard. CBD showed no significant or clinical differences compared to placebo in side effects. Let's see, 4 weeks of treatment with increasing doses of CBD up to 1,500 milligrams a day. Again, this is a lot. It's way more than any of my customers so far have needed to take to get incredible symptom relief for very severe things sometimes. But anyway, at that dose, 1,500 milligrams a day, not only was the treatment-resistant schizophrenia a significant improvement of symptoms, they say, there were no adverse effects after hospitalization and 4 weeks of treatment. More recently, 3 patients with treatment-resistant schizophrenia, and they were taking 1,280 milligrams a day for up to 4 weeks. No side effects reported, even at the highest dose. We have 2 patients with bipolar disorder. Again, their condition was improved. They took 600 to 1,200 milligrams a day for up to 24 days. No side effects reported. A double-blind study now we have, and that's a great study yet again, with 42 patients diagnosed with schizophrenia or schizophreniform disorder in an acute episode, showed that CBD at 800 milligrams a day significantly reduced psychotic symptoms after 2 to 4 weeks of treatment and induced fewer side effects such as extrapyramidal symptoms, increased prolactin levels, and weight gain compared to, here's that word, amisulpride. Yeah. Amazing. Why don't we talk about this? Why are we saying, we don't have any studies. We don't really know anything about it. We don't know. But no. Yeah, okay. So I hear you. We don't have thousands of people all in one study, but we probably do have thousands of people if you put these studies together. And that's a lot. And this has been going on since the 70s that we've been looking at this. And this is a consistent finding. All right. Parkinson's disease, flexible oral dose of CBD ranging from 150 milligrams a day to 400 milligrams a day, and their usual treatments showed that psychotic symptoms were significantly reduced. Cognitive and motor symptoms were not affected in a good way. They mean they weren't made worse, which the other drugs do tend to do, by the cannabinoid, and no serious side effects were reported. A 19-year-old female with a history of cannabis addiction received CBD 300 milligrams on day 1, 600 milligrams divided into 2 doses, days 2 through 10, and CBD 300 milligrams on day 11. And during treatment with CBD, the patient did not report any marijuana withdrawal symptoms, and she did not experience anxiety or dissociative symptoms, as assessed by standardized rating scales. Okay, so the one thing we do need to talk about is that it inhibits hepatic drug metabolism through the cytochrome P450 pathway. What that means is that if you are taking drugs that are metabolized by through that pathway, then their breakdown can be slowed by CBD, which also works through that pathway. This isn't necessarily a bad thing. It's something to be aware of, however. And Harvard did a study of some 500 drugs to see which ones actually interact in this way. and came up with a list of about 50 that really should be monitored when using CBD if you're using it at the same time. Now, it doesn't say you shouldn't use them together, because actually what often happens is the CBD allows for a smaller dose of those drugs, which means there are less severe and less side effects from that drug. So overall, it is actually a really good thing, but it is something to be aware of, because that drug can cause whatever the drug side effects are, they can get more severe if you're not aware that the CBD may potentize them. So that is something to be aware of. That is one of the only cautions. Oh, I thought this was interesting. I guess they just wanted to test if they could cause CBD to really cause harm, because they were not finding it to cause harm in any of these studies, even at very, very high doses. So they injected rhesus monkeys with very high doses, so 150, 200, 225, 250, or 300 milligrams per kilogram. This is insanely high. None of these studies do anything like that. No one's dosing humans like this at all. This is insane. And yes, and it was injections. And yes, at that level, tremors were evident, they were hurt, and it was not good. So don't inject yourself with what would be the equivalent 150 times, 150 times 100. I'm so bad at math. That would be 4 zeros. 10,000. Don't inject yourself with 10,000 milligrams or more of CBD. That won't go over well. So we learned not to do that. That's basically what they found. And they found at oral doses, you can maybe cause yourself harm at 300 milligrams per kilogram. There were no significant changes in growth rates, rectal temperatures, EKG recordings. Those were all fine, even at 300 milligrams per kilogram. But yes, at that high dose, which again is, if you take 30,000 milligrams a day, and I'm telling you, the highest dose anyone has ever given anyone is 3,000 milligrams a day for children with seizures. But if you want to give yourself 30,000 milligrams per day orally, you may start to hurt yourself. That's what they found, and that's why I'm mentioning these upper limits, because the doses that my customers are generally taking is maybe like 100. I mean, if you're really severe, you may take 50 times 6, 300 milligrams a day. That's for a severe case, but 100 is often, more than adequate. Sometimes they only need 20, 30. Sometimes people only need 5 or 10 milligrams. Those are the doses I'm talking about. So, but they did find that if you want to give someone 30,000 milligrams CBD, that yes, there was an increase in all the organ size. There was a decrease in testicular size, and they stopped spermatogenesis completely at 300, but not at 100. So even if you gave yourself 10,000 milligrams of CBD, which would be insane, I don't know why you would do that, but if you did that, even then, it didn't find inhibition of spermatogenesis, since we're talking about this reproductive stuff, since THC may have these concerns. We don't even know that, but it may have these concerns. But CBD, you can take 5 of my strongest bottles or something, you still will not inhibit spermatogenesis in yourself. So anyway, it concludes with several studies suggest that CBD, more than several, this 132 studies suggest that CBD is well tolerated and safe in humans at high doses and with chronic use. Now, there is an update. I wanted to take this study in 2017 and just look at some of the increased understanding that we've gained. Most of it's very much the same, but I will include that there was some more long-term studies with epilepsy, and I think this one we didn't discuss, 3 months with 137 children and young adults with various forms of epilepsy. In this study, 50% of the patients experienced a reduction of seizure frequency, and they did have some side effects: tiredness, diarrhea, and reduced appetite, and a little bit of weight loss, and one had elevated liver enzymes. But what it says is that they were taking, like we talked about, that pathway, and they were taking very high level epilepsy drugs, which can cause those problems. And so in combination with CBD, perhaps it was too high a dose of those high level those pretty toxic epilepsy drugs. They did not find this in the children or young adults that weren't taking the epilepsy drugs. Only in the ones that were taking the epilepsy drugs. And then we have the largest CBD study so far in 261 patients. Average age was 11. Severe epilepsy yet again. 3 months of treatment, reduction of seizure frequency by 45%, 10% of them. And again, these kids are on other drugs, so this pathway issue can come into play. But their big side effects are tiredness, diarrhea, and exhaustion. So we're talking about, they don't say here the dose, but these kids are usually taking around 3,000 milligrams a day. They're usually taking a very high amount. It says, after extensive literature study, the available trials performed until September 2016, so updating from 2011 to 2016, CBD side effects were generally mild and infrequent. The only exception seems to be a multi-center open-label study with a total of 162 patients with treatment aged 1 to 30 years with treatment-resistant epilepsy. They were treated for 1 year with 25 to 50 milligrams per kilogram oral CBD. So again, that's very high, 5,000 milligrams, about 2,500 to 5,000 milligrams a day for many of these maybe 100-pound children, plus their standard medication. And this led to a great reduction in seizure frequency, but a lot of them did suffer from sleepiness, decreased appetite, and diarrhea. And those were the big side effects. And they were taking other drugs, very, very heavy duty drugs. Those are the best 2 studies for us to look at to really understand where the state of safety is. There are many, many other studies that, again, repeat from these studies. You know, that 1,500 milligrams a day is well tolerated. Let's just say that again, because I think it needs to be said. Chronic use and high doses up to 1,500 milligrams of CBD are reportedly well tolerated in humans. And that's where we are. You don't need that much. You actually need quite a bit less than that, almost for sure. My customers are thriving on, like I said, anywhere between 10 milligrams a day all the way up to about 600 for very severe panic, some sort of fibromyalgia and pain situations. Migraines, people are taking like 300 milligrams, 400 milligrams to be okay. And those are the situations in which people dose the highest. Otherwise, it can be quite low, and people can, their whole lives can change. So I thank you all for listening. If you got through this, and I'll make some little short videos too, hopefully. And I hope you all have a wonderful day. I'm always available if you have any questions or concerns or thoughts, or you just want help with dosing or how to best use your CBD or which kind to get. All right. God bless you.